Arrived. Good morning, Dr. Ishwar. Good morning, Dr.
sir.
Ishwar.
Good morning, sir. Good morning, sir.
Good morning.
Good morning,
Yeah.
sir.
I hope you are done with your earlier meeting, sir. I heard
Yeah,
that you are busy with WHO meeting.
it is continuing. I am at, because I was yesterday my talk was there, but it has been postponed it today. Just now,
Yeah, very nice. We're nice to
very
have.
nice.
I think we are ready to start.
Yes.
Good morning,
We'll
sir.
wait
Namaskar,
for a few
namaskar.
minutes.
Hari Om, Namaskar.
So the way forward we see for our Healthy Lifestyle Center program and physical education through that, it was provision of basic exercise equipment to the well-functioning HSCs.
Good morning, Dr. Nidhi.
And that refresher trainings for the trained staff again. And we have a plan to establish indoor.
Shall I speak without PowerPoint, or would you like to my PowerPoint and PC?
Staff to liaise with
Sir,
other.
A very good morning to one and all present here. I, Shani, on behalf of LearnNet, welcome you to the webinar on Indian specific guidelines for management of PCOS in association with Kasturba Health Society Medical Research Center. And LearnNet is proud to be associated with Kasturba Health Society Medical Research Center as a digital partner for digital CMEs and webinars. Having said that, now I would like to play a short LearnNet video and would request everyone to please have a patient look. Thank you so much. Thank you so much for your patience. Now, without any delay, I would like to request Mrs. Shubhada Agasti ma'am to take over the session. Ma'am, over to you.
Thank you, Sonaki. Thank you very much. We are very thankful for your continuous support. Okay, thanks, Shobha. Okay, I am Shubhada Agashe, associated with KIHS-MRF as an Assistant Director, Clinical and Endocrine Laboratory. As you all know, KIHS-MRF stands for Kasturba Society's Medical Research Center, and our partner is ICMR's NIRRH. Today, it's an international webinar on Intersystem Dialogue. It's a fourth in series of our Intersystem Dialogues. Earlier, we had an opportunity to listen to yoga experts, homeopath experts, Siddha experts. These intersystem dialogues are primarily organized by both these institutes to address a very important and very burning issue of polycystic ovarian syndrome. We are in a process of formulating India-specific guidelines for management of polycystic ovarian syndrome. As you all know, it hampers women's life right from adolescence through reproductive age till menopause. We dedicate this webinar to a very famous Gujarati poet, philosopher, Dr. Sai Makran Dave. Now, Dr. Sorry, he was much above that. What he has said about yoga is yoga manifests in every life and illuminates wisdom, word, work. That is our oneness with Supreme. What a wonder of wonders. Thank you very much, Shobha, for sharing this slide. This is his centenary year. We are celebrating centenary year of Sri Makaran Mama as we all address him. And now we'll start with our inaugural session with Medha Suktam by our Assistant Academic Director, Dr. Shobha Iyer. Over to you, Shobha.
Om
एकदन्ताय विद्महे वक्रतुण्डाय धीमहि तन्नो दन्तिः प्रचोदयात्। यश्छन्दसा मृषभो विश्वरूपः छन्दोऽभ्योऽध्यमृतात् सम्बभूव समेन्द्रो मेधया स्पृणोतु अमृतस्य देवधारणो भूयासम् शरीरं मे विचर्षणम् जिह्वा मे मधुमत्तमा कर्णाभ्यां भूरि विश्रुवम् ब्रह्मण कोशोऽसि मेधया पिहितः श्रुतं मे गोपाय मेधा देवी जुषमाणा नागाद्विश्वाची भद्रा सुमनस्य माना त्वया जुष्टा नृतमाना दुरुक्तान् बृहत्पदेम विदते सुवीराः त्वया जुष्ट ऋषिर्भवति देवि त्वया ब्रह्मा गतश्रीरुतत्वया त्वया जुष्टश्चित्रं विन्दते वसुसानु जुषस्व द्रविणो न मेधे मेधां म इन्द्रो दधातु मेधां देवी सरस्वती मेधा मे अश्विनावुभावा दत्तां पुष्करस्रजा अप्सरासु चया मेधा गन्धर्वेषु चयन्मनः दैवी मेधा सरस्वती सामा मेधा सुरभिर्जुषताग स्वाहा आमा मेधा सुरभिर्विश्वरूपा हिरण्यवर्णा जगती जगम्या ऊर्जस्वती पयसा पिन्वमाना सामा मेधा सुप्रतीका जुषन्ताम् मयि मेधां मयि प्रजां मयि अग्निस्तेजो दधातु मयि मेधां मयि प्रजां मयि इन्द्र इन्द्रियं दधातु मयि मेधां मयि प्रजां मयि सूर्यो भ्राजो दधातु हंस हंसाय विद्महे परमहंसाय धीमहि तन्नो हंसः प्रचोदयात्। ओम शांति शांति शांतिः। योगेन चित्तस्य पदेन वाचा मलं शरीरस्य च वैद्यकेन योपाकरोतं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलि प्रणतोऽस्मि।
Thank you, Shobha. Thank you. It was wonderful. You have set the tone of our today's webinar. Thank you very much. Now for the formal welcome of all the participants. As I can say that there are already 73 participants have logged in. On behalf of faculties and students and postdoc students from KIHS-MRF and NIRH, it's my pleasure and privilege to welcome you all for today's international webinar on Intersystem Dialogue, Perspective of Yoga and Naturopathy. Yoga, as you all know, is a discipline that focuses on harmonizing mind and body. It's an art and science of healthy living. And of course, you all are very much aware in PCOS girls, is this harmonizing is altered and they suffer a lot throughout their lifespan. And it's our endeavor to bring to a common consensus that how this polycystic ovarian syndrome can be diagnosed and treated, because we know that conventional medicine has their own treatment, but we have a tradition of traditional medicines of which can be traced. As far as yoga is concerned, we can trace its origin to 505th or 6th BC, before Christ. This thing has started. So before taking much of your time, I hope our chairpersons are there. I would like and request to welcome our chairperson, Dr. Geeta Balsarkar. Geeta madam is there. As many of you must be knowing her very well, Dr. Geeta Balsarkar is DGO MBBS, MD OBGYN, DNB OBGYN. Madam works as a professor at GS Medical College and Nauroji Vaidya Maternity Hospital. She's a clinical secretary of MOX, vice president of Menopause Society Mumbai branch, president of AMWI Mumbai branch, associate editor, Journal of OBGYN of India, Foxy Journal. Madam has over 18 years of teaching experience. She's actively working on a Foxy project on postpartum IUCD in India, undergoing training for the same, and also she is a faculty member of training program of many such programs. She is a recipient of prestigious Hargobind Foundation for the study of fetal medicine in 2008 at St. George Hospital, London. She is a chairperson of Young Talent Committee of Foxy and associate editor of the journal. I welcome Madam to take a chair. I hope Madam you are there. And our co-chairperson, Shobha. Co-chairperson for this inaugural session is Dr. Ashish Padke. He is MD Ayurveda, MD Psychology, MA Philosophy. He has done diploma in yoga. He is associated with KIHS-MRF as Honorary Deputy Director of Division of Endocrine and Metabolic Disorders, Lifestyle Module. Sir has been associated professor and ex-associate professor and head of Department of Dravya Guna for more than 10 years. He is associated with many organizations. Few of them are Somaya Sanskriti Pitham, Padma Sambhav Yoga Institute. He is a consultant in many national and multinational pharma companies for last more than 25 years. He is practicing yoga Panchakarma consultant, and he has many publications in national and international journals. He has presented papers in many countries. I request Fadke sir to take the co-chair. And with this, I hand over this platform to chair and co-chairperson for the further activities. Over to you, Ashish sir.
Yeah. Thanks a lot for very kind introduction. And I thank both the organization, KIHS-MRF as well as NIRH, for giving me opportunity to be with all of you and having this great experience. Can I have Dr. Balsarkar, madam?
Somebody could call, and if she's not there, go ahead.
We will continue.
We continue. Okay. We continue.
She's trying to log in, ma'am.
Okay.
So friends, we are actually going ahead with this very first inaugural session in which we will be having discussion on basic aspects about this PCOS and yoga. And we have got fantastic speakers to share their views with. We have got Dr. Vaidya, Ashok Vaidya and Dr. Rama Vaidya. Then none other than Dr. Ishwar Basavaraddi sir from Morarji Desai National Institute of Yoga and Naturopathy, and Dr. Carolyn from Australia. So I would, should we wait, madam, for Dr. Balsarkar, ma'am?
I think she'll join. We have very little time,
yeah.
And we want to do justice to everybody's talk.
Okay. So I would request I would like to introduce our first speaker in this particular program, that is Dr. Ashok Vaidya sir and Dr. Rama Vaidya madam. So I'm taking opportunity to introduce all of you our beloved Dr. Ashok Vaidya sir. He is MD in Internal Medicine and Therapeutics from GS Medical College, KM Hospital, Mumbai, and he has done his PhD in Clinical Pharmacology from Yale University. He is Professor Emeritus to KIHS-MRF, and he was former research director of our institute, that is KIHS-MRF. He is a visionary who has given a concept of reverse pharmacology Dr. Vaidya sir was a Merck International Fellow in Clinical Pharmacology at Yale University School of Medicine. Dr. Vaidya is an eminent clinical scientist dedicated to new drug development and scientific research for more than 3 decades. At SIBA Research Center for a quarter of century activity, he was actively involved for drug research, and he has been a consultant and expert to organizations like WHO, CSIR, ICMR, DBT, Ayush, and for the 11th and 12th 5 years plans of India. Sir is a visiting professor at Gujarat Cancer Research Institute, and he has been appointed as adjunct professor at Drexel University, USA. And our next speaker is, along with him, Dr. Rama Vaidya madam is also going to be there. Can I have her profile? Dr. Rama Vaidya ma'am is MD, DGO, DFP, and PhD in Applied Biology, Ford Foundation Fellow, Biomedicine, Yale University School of Medicine. She is Director, Division of Endocrine and Metabolic Disorder, KIHS-MRF. She is Research Director, Reproductive Medicine, BACS Hospital, Consulting Reproductive Endocrinologist, Vasudha Clinic, Santa Cruz. She has established fertilization in vivo model in rabbits for studying as a food as a focus on with a focus on
Sperm capacitation.
Yeah. One sec. It is not there, ma'am. Can I get the slide, please? I'm not able to see the slide.
Yes, sir. Just 2 seconds, sir.
Brief introduction will be appropriate.
In the meanwhile, I would like to welcome Dr. Geeta. She has just joined.
Yeah. Great.
Welcome, Dr. Geeta.
Yes.
I request you to take the chair.
Can I have the slide of ma'am, please, so that I can complete that part?
I think if there is a delay, right away, straight away, Geeta, say a few words. Thank you, Dr. Phadke. Thank you very much for kind introduction. And I think we go ahead with the program, which is very important. And I was finding on the chat box that Dr. Nilima Kshisagar could not hear properly because of the low volume. How are you doing, Dr. Kshisagar? Nilima Ben? Hello? Yeah? Okay. So go ahead, please.
Yeah, Dr. Geeta ji, please have your remarks, opening remarks.
I think madam is busy in the hospital.
Okay.
We can proceed with ma'am. Okay, that's
okay.
she's
So
busy.
let us start with the then first session by Dr. Vaidya sir and Dr. Rama Vaidya ma'am.
Okay. Thanks, Geeta, from a real yogic exercise that you are in action right away. And thanks for coming in. Yeah. Yeah. So shall I start with the
Before
permission of the
madam you
chair?
start,
Yeah.
I request all the participants and panelists to please keep your mics on mute, please.
Yeah. So good morning, respected chairpersons, Dr. Geeta and Dr. Phadke. And I'm extremely thankful for the organizing committee of this international webinar. When I say that, well, am I a part of it? I think most of the work has been done by the organizing committee, and none other than Dr. Ashish Phadke, who is an yoga expert, Dr. Satish Pathak sir from with his vast knowledge and experience from both conventional medicine and yoga. And so it's a great thing that this organizing committee has chosen us and given us this opportunity to speak on yoga. Is it a therapy or is it a lifestyle for PCOS? And before I speak of that, my thanks to also Dr. Carolyn Ee and Dr. Vibhuti and Subhada and Shobha Madam for taking up this responsibility of organizing an international webinar for India-specific guidelines. And is it that how the yoga and naturopathy has played a role for this area of looking into the PCOS? With that, those words and thanking, I would like to straightaway go to my talk. And many thanks to the co-author who is here, Dr. Ishwar Basavaraddi, who has continuously guided me throughout life for how yoga has to be interwoven in daily life. So may I have the next slide, please? The next slide.
I want it done in the next half an hour. Tell her that.
Shobha, unmute. Shobha, mute yourself. Shobha, Dr. Shobha, madam. Yeah. Okay. So we know that there is a galloping prevalence of PCOS, and it's a major public health issue. But who is treating this heterogeneous disorder with a wide spectrum of clinical manifestations that you see on this carton? Dermatologists, gynecologists and reproductive endocrinologists, or medical endocrinologists, radiologists. Who is treating? Because it has a spectrum of clinical manifestations in each super specialty. And I would not go into the details. But most important, have we forgotten one area, and that is the psychological issues related to this? Is anxiety, depression, psychosexual, psychosocial, are these primary, are these secondary? This is a mute question, and maybe we'll be able to. And I also want to clear one part of my introduction. I was introduced as the first one to look into, yes, very early we have looked into, but I must thank who's another person who, Dr. Nidhi Chaudhary, who also did it in 2011. And in spite of her personal tragedy in the family, today she's with us. And Nidhi, many thanks for your presence here. Extremely thankful for that. Yeah, next slide, please. Now, very important, is intersystem dialogue really required? We think that it's a prerequisite to integrative healthcare. And if at all Government of India is thinking about one nation, one healthcare, then it is time, high time that we start an in-depth intersystem dialogues. And KIHS-MRF and ICMR and IRH. And I'm very thankful to Dr. Neelimakshi Sagar's presence because she's looking into some of the product development center and the entire area. She's a chairperson there. And she is also very carefully looking into that how PCOS can be and how we can develop India-specific guidelines. And we cannot forget the Ayush systems of medicine, and each one is also looking into the treatment of PCOS patients. And that Vanita Suri has very rightly expressed that. She's a part of the community medicine from PGI Chandigarh. In a very recent article in 2021, clause 1, she says that multiple healthcare agencies were consulted by 85.8% of the respondents. And what says that they were equally dissatisfied with all, including the conventional medicine. And we'll have to look into, Dr. Anushri Patil, we'll have to look into that. Why are they dissatisfied? And we have had the Intersystem Dialogue Series 1 was, convener was Dr. Nutan Nabar and Dr. Supriya Balera. And there are many Ayurvedic physicians who took part, including Dr. Tanuja Nesri. Then Dr. Survi Khemka and Dr. Anushri Patil had spearheaded the series 2, in that homeopathic experts gave it their views, and none other than the National Institute of Epidemiology, Dr. Manikam and Dr. Rajalakshmi convened this meeting for Siddha, and it was very much eye-opening how Siddha system of medicine is dealing with PCOS, and some of that was in depth. And today we have Shubhada Agashe and Dr. Vibhuti Rao who have convened this, and thanks to both the conveners. And let's have the next slide, please. So really speaking, all the non-communicable diseases are low-grade systemic and chronic inflammatory diseases. And very nicely, Agar-G, in search of a germ theory equivalent for chronic disease, because we all know that germ and classical acute infectious response is like a classical inflammation. It is like a raging fire. And there, actually, through all the entire resolution that occurs because of the basal homeostasis, while in the case of these NCDs, which are low-grade systemic chronic inflammatory diseases, including PCOS, and we had asked this question very early because we came across in 1980s, really speaking, it was 86, that we had a patient of familial partial lipid dystrophy, the extended family of 167 that were traced, 30 were examined in details, and we found that it was an insulin resistance syndrome. As a part of the syndrome, one of the patients had a polycystic ovaries. But as it is said in Rotterdam definition, that it should be a diagnosis of exclusion. So, but that initiated us to look into the insulin hyperinsulinemia and insulin resistance. And then we finally, in 2003, in Indian Journal of Endocrine Metabolism, had given our first cohort of 90 patients where 75% had insulin resistance. As you can see in this cartoon, that Agar has given that insulin resistance and oxidative stress are the main reason for meta-inflammation. And it is like a smoldering fire, and it causes a chronic allostasis. And we have shown, we had also asked a question, and others have asked similarly, that is PCO a chronic inflammatory disease? We did find that there are HSCRP, TNF-alpha, IL-1 beta, IL-6, all these pro-inflammatory cytokines were increased in the patients of PCOS. We also found that when we had applied monitored medical nutrition therapy that had included yoga also as a part of the therapy, at that time, adiponectin had gone up, which is a cardioprotective, with the resolution of the chronic inflammation also. As we can see now in the next slide, that this chronic allostosis is like Hans-Sely did propose way back, and it is a dominant explanation framework for physiological regulation. But Peter Sterling has come up with allostasis, an alternative view of physiological regulation. What happens here is, as you can see in this cartoon, that the levels of stress mediators keep on fluctuating as the stress stimuli keep on occurring time and again, and it's a chronically repeated stress stimuli. With that, it mounts the levels of stress mediators keep going up and down and up and down, and finally, allostatic load increases to such an extent, and wear and tear of this chronic stimuli and chronic repeated stress stimuli, finally there is wear and tear, and it gives way, and a new set point of the homeostasis occurs. But sometimes it fails, it gives way. That's why in a very recent article also, the authors say stress reduction program should be included for early detection of the common psychological consequences of PCOS in adolescents, hopefully breaking the vicious cycle. And why the vicious cycle? Because there are also secondary stresses, also secondary causes for psychological anxiety and depression, like the cosmetic discomfort of hirsutism, acne, acanthosis nigricans, infertility, and so on and so forth. Next slide shows that does yoga reduce and resolve allostatic load and reinstate homeostasis? The studies that has evaluated changes in polycystic ovarian morphology, we did find also in our patient complete resolution of hepatomegaly as well as the polycystic ovary, and it had resumed but it was a lifestyle where yoga is just a part of it. Molecular signature of the immune response to yoga therapy in stress-related chronic diseases conditions and insight is a very good article. The same way, the meta-analysis of impact of yoga on inflammatory biomarkers, a systematic review, sorry, not meta-analysis. There were 15 articles that they have reviewed which finally they had chosen for many articles. And they have shown that HSCRP and IL-6 and TNF-alpha, these three that they had seen, that whether yoga was also associated with pranayam or associated with meditation, or it was only yoga asanas, still they found in all these articles that these pro-inflammatory cytokines had declined. Dr. Anushri Patil, who's here, had very nicely with us, has written yoga therapy as the fourth dimension in the multidisciplinary management of women with polycystic ovarian syndrome. And this should be given importance, where I think Dr. Satish Pathak is very, very close associate of us in this area of yoga therapy as the fourth dimension of multidisciplinary management of women with PCOS. Next slide, please. So Dr. Vaidya, the other day, when we were sitting and talking about it, synthesized the definition of yoga from Patanjali Yoga Sutra and Bhagavad Gita. Chitta vrittihi nirodhena samatvam prapnotiti. Samatvena sarva kriya karmeshu kaushalyam upalabhyate. Kaushalyena atma prabha pragna paramitaha prakatayati. And thanks to Dr. Chaya Godse's father, who's helped us in making this slide, one attains balance of mind and stillness of consciousness by the cessation of random thoughts. With such consciousness, one achieves excellence of skills in one's actions. Such an excellence brings glory and manifestation of intuitive intelligence. Next slide, please. The next. Yeah, I think it has been shown that PCOS, a large number of them, has hyperactive, and there is a definitely an imbalance of the vagal tone is poor. So in the autonomic nervous system, say this samatvena sarva kriya karmeshu kaushalyam upalabhyate, and with the excellent vagal tone, probably Arjun has shown a great kaushalya in this pattern that is self-explanatory. And there is a overexcitement. Siddhanti mama gatrani mukha parishusyati has happened again to the same person. So it can happen that the chronic allostatic load or acute allostatic load can occur in a situation and the battlefield where you are faced with difficult situations. Next slide, please. So a century of research in the science of yoga, 1921 to 2021. In the year 1921, Swami Kavalyanandji started research in physiological, psychological effects of yoga. He was inspired by Sri Madhavadas Ji, his yoga preceptor. Later, he established Kaivalyadham for research in yoga. And it was a very interesting story that we got a chance to read. Mr. Behanan, a Yale PhD student, worked with the Swami Kavalyanandji. Experiments were for metabolism, blood pressure, and heart action in relation to pranayam. It was said that Kavalyanandji was invited at Yale University. He was to go there, but it was 1930s when it was very difficult because America was passing through a Great Depression and he could not avail of that opportunity, but he has contributed a lot to the research in the science of yoga. Next slide, please. Wonderful article. The day when we were planning this webinar, an international webinar, because Dr. Vibhuti was very much with us, and indirectly Dr. Carolyn Ee was very much with us. And while we were talking, Dr. Vaidya just declared that I'm going to talk. And when he said I'm going to talk, I started looking into the genuine recent explanation on the aspects of yoga therapy, how it is perceived scientifically currently. And in a recent article, and I have loved reading this article, and one needs to read and reread and reread to understand completely, because the authors have taken such dedicated efforts to understand from it is really a convergent science, I would say. And in this, a model where a yoga foundational framework converges with current ideas in neurophysiology and biobehavioral regulation. Yoga therapy and polyvagal theory, the convergence of traditional wisdom and contemporary neuroscience for self-regulation and resilience, is a fantastic article. And this is an eye-opener. You can see almost a figure of an eye. And one side, it is a Purush, observer of the body, mind, environment. And on the other side, it is a Prakriti, Gunas, body, mind, environmental conditions, and also interactions. And there he talks about Sattvic, Rajasic, and Tamasic Prakriti. And in that, in order to achieve the self-actualization that is in the center, eudaimonia. This word is a very important word, that if we want to achieve this, then we have the sympathetic parasympathetic balance that we have created. And that balance remains, which, yes, goes up and down. And the sattva, and in that, it's very nicely ventral vagal complex has been explained. Today is not the time. I have only very few minutes left, perhaps. And Rajasic is with a sympathetic. And sympathetic overactivity has been shown in the patients with PCOS. It is probably an integral component, as much as you say that there is a chronic inflammation and there is insulin resistance, and that actually activates. So is it primary component? Is sympathetic overactivity is a primary component, and sympathetic parasympathetic imbalance, is it a nature of the, and we will have to look into that every time that we see any patient, we should do that. So with that, the next slide. The next, please, the last one. Sai Makrandave, a visionary poet prophet, and his birth century also. In order for us to accomplish this harmonious movement to understand cosmos, we have to do two things together. We have to calibrate our inner laboratories. I always say that always start any talk with Om, at least say Om. It is a question of collectively calibrating our inner selves so that we are mindful of what we talk to each other. It's a dialogue. And to study words of our great masters. One way would be to organize group meetings and invite the persons who have gone through experiments and experiences. This is an adventure in consciousness. This is a kind of awakening. Without pure awareness, we will be stuck in twilight region. What is called peak experience is always combined with love, compassion, friendliness, and goodwill towards others, to all. And so, with the IO systems of medicine and conventional systems of medicine, we all from biomedical field are dedicated to see that and have dialogues, and no cross-pathies is looked down upon, but try to understand. And with these words, this was my last slide. Thank you so much for patient listening.
Yes, Dr. Geeta, madam. May I have Dr. Geeta, ma'am? I'm really happy to have lecture of our ma'am, Dr. Rama madam, and Dr. Ashok Vaidya sir. And I would request to have next, sorry, is someone saying? Yes, Shobha?
Geeta is saying something. Dr.
Yeah,
Geeta?
please.
Ma'am, that was a very excellent lecture. And really, yoga is today the fourth dimension. Not only is it the fourth dimension, it's the most important dimension in today's life. And I'm very happy that you chose to speak on this particular topic today. You know, the country, as a country where we stand, and today yoga is really very important, not only in PCOS, it is just the beginning, but even in other ages of life.
Yeah. Thank you so much. Thanks for your presence. Thanks for your presence. And I may just say a few words about Dr. Geeta. When Dr. Geeta came to KIHS-MRF for one of the functions, she said, I'm a proud obstetrician, because today not many people want to do obstetrics, but she does. She loves that. And she is a great teacher, very popular teacher. And thanks for your presence, Dr. Geeta.
Thank you, madam.
Shubhada.
Okay, sir. Will you be introducing Shobha, madam? Okay, I take this opportunity to introduce.
I don't think there is a need.
No, ma'am. I take this chance to introduce
Please.
you, Dr. Shobha Udupi. She has done her PhD in food and nutrition. She is a research director of KIHS-MRF, honorary director integrative nutrition and Ayurvedical, and former national president of Indian Dietetic Association. Shobha madam has done a PhD in food and nutrition from Purdue University in USA. She has worked extensively in community development programs for urban development and training as a part of government of Maharashtra. Principal investigator for 51 projects supported by Ministry of Health and Family Welfare as well as national agencies. Published nearly 80 papers in national and international journals, 7 chapters in books, 4 books, 2 manuals, 12 monographs published by Department of Food Science and Nutrition by SNDT University. She has guided over 14 PhD students and currently guiding 5 students. And still she is saying that there is no need to introduce. Ma'am, with this, I request you to introduce our guest of honor. Thank you.
It's indeed a great pleasure to welcome our guest of honor, Dr. Carolyn Ee. Dr. Ee, at the outset, may I express my great appreciation for consenting to spare your time and to associate with us, and to also that we have your colleague and younger colleague, Dr. Vibhuti Rao, who is this, and I would like to introduce you very briefly to our audience. Dr. Ee is a doctor. She has also done applied science and Chinese medicine, has also got her PhD degree. She is a senior research fellow of the JACA Foundation. She has many achievements and awards to her credit. She has been awarded the NHMRC Center for Research Excellence in Women's Health and Reproductive Life, a grant in 2021. She also has received grants from Cancer Australia for supporting people with cancer, and a grant for looking at traditional medicines from the Australian Traditional Medicine Society, as well as from the Cancer Council, New South Wales. I think with the person who has who is so well qualified and who has such extensive interests in women's health and in their reproductive life, as well as in traditional medicine, it is but natural that we would look to you for a very interesting and enlightening talk. And we also hope that we will continue our collaboration and relationship in the future for in the interest of women's health across the world. Thank you so much. And I now request you to speak, please. Thank you. My role is over.
Thank you very much, Dr. Udupi, and thank you so much to the KIHS-MRF and the ICMR and IRRH for inviting me to this Intersystem Dialogue. I am truly really very honored and also really humbled to see, I guess, it's a really fantastic opportunity for me to see the true integration that can happen. It's just thrilling to see MDs and and obstetricians, really advocate for the important role of yoga. I'm so excited. I think we can really learn a lot from you in Australia. So I think I will take this back to my colleagues, to our research institute, because I think you are really doing some innovative work, and I commend all your efforts in this area. I would like to talk to you today to, I guess, provide you an evidence update for clinicians. I know that majority of people attending would be from the biomedical field, and this is taken from a talk that I gave to GPs. I was asked to present a talk on natural therapies for women's health, and also together with my colleagues at the Monash Centre for Health Research and Implementation, we've recently had a narrative review published that outlines a lot of the evidence that I will be presenting today. So I'm really happy to share that with the institutes when that is published. So I'm going to start with the role of probiotics, and I was really interested to hear Dr. Vaidya talk about, meta-inflammation. I completely agree. This is a very important concept in PCOS that we are only starting to address. Now, we know that women with PCOS have reduced gut microbiome diversity, and so this will actually increase the risk of systemic inflammation from the intestinal permeability. Now, a lot of this work is a little bit early, it's preliminary, but what we do know is that from a couple of meta-analyses is that probiotics can reduce some inflammatory markers and some metabolic markers as well. And they are also generally safe and widely available, although many RCTs did not actually report adverse events. And usually the adverse events are very minor, but I think if a woman has immunocompromised, then I would avoid prescribing probiotics just in case. Now, let's go on to thinking about micronutrients. So we know that women with PCOS are obviously more likely to be overweight and obese. That's very clear to all of us here, I think. And we also know that micronutrient deficiencies are very common in people who are living with obesity. This is partly due to a poorer diet, but also there are some physiological changes in obesity that cause sequestration of nutrients like vitamin D. So about 70% of women with PCOS will have a vitamin D deficiency, and there are also some other deficiencies like zinc, magnesium, folic acid, calcium, and vitamin B12. Now, as a clinician, it's my preference to always try and address the diet first to optimize nutrient intake. But let's have a look at some of the evidence around micronutrients and obesity. Now, there is some early evidence that women with PCOS may benefit from supplementation with magnesium and zinc and calcium, but you can see these RCTs are very small. And also we need to consider some of the potential side effects. So for example, high doses of vitamin E have been linked to increased mortality. Now, I think out of all the natural therapies for PCOS, inositol has the most evidence. So there have been several meta-analyses that suggest that it can improve insulin resistance compared to placebo, and it improves some of the glycemic markers as well. It may also help with reproductive outcomes. So it looks like it probably improves menstrual regularity, but there's not a lot of data around fertility. So there's just one small trial on pregnancy rates, and currently there are no studies that looked at live birth rates. However, when we compare inositol to metformin, it's as effective for insulin resistance, and it's also much safer. So as you all probably know, they are risks to using metformin. There's diarrhea, for example. Inositol is generally very, very well tolerated. It's also very low cost. It's a very cheap supplement. So that I think that increases, the access to inositol. Now, for other nutraceuticals, so again, going back to the concept of inflammation. So N-acetylcysteine, or NAC, is an antioxidant, and it can improve insulin secretion. And it's generally also very safe, so important to know as a clinician. It seems like it can have some metabolic and reproductive effects. So, for example, it reduced BMI and testosterone, but there was no difference for insulin levels, and it may also help with pregnancy and live birth rates, but it's not as effective as metformin for this. Now, and then there's some smaller trials for some other nutrients. So I think these are possibly beneficial. So vitamin D may improve insulin sensitivity. One trial of coenzyme Q10 also improved insulin sensitivity. And then a very small trial on melatonin suggested that sleep quality and anxiety, which as Dr. Vaidya highlighted is extremely important and I would say neglected in women with PCOS. So there are some nutraceuticals that don't seem to be beneficial and are possibly harmful, so I would avoid these. So chromium didn't seem to have much of an effect on insulin resistance, and it actually raises androgen levels. Resveratrol didn't make any difference to fertility rate in one small trial, and omega-3 fatty acid showed no difference compared to placebo for insulin resistance. Now, what about herbal medicine? So there's some early, I guess, preliminary evidence on some herbal medicines, and there's the most evidence probably for cinnamon, which has some effects on the metabolic markers, but unfortunately no effects on weight and BMI. There's been a couple of RCTs done on curcumin and on sage extract. And again, these would work as antioxidants and would work to reduce inflammation. Unfortunately, there's insufficient evidence currently to support the use of Chinese herbal medicine for fertility in women with PCOS. Okay, so I am a traditional Chinese medicine practitioner as well as a MBBS, and so my passion is on the use of acupuncture for PCOS. And I was also really excited that Dr. Vaidya talked about the importance of looking at sympathetic tone and the balance between parasympathetic and sympathetic nervous systems in women with PCOS. So certainly there has been quite fundamental research done that suggests that acupuncture may actually help by reducing sympathetic tone and increasing parasympathetic tone. So I think that's really, really interesting. There have been a lot of studies looking at fertility, and they show that there are improvements in menstrual regularity, but there are no improvements so far on pregnancy rates. And my team and I are currently working on a systematic review on weight loss, so looking specifically at women with PCOS who are living with overweight and obesity, so BMI over 25. And here we find that the combination of acupuncture and metformin appears to be better than acupuncture alone or metformin alone. And acupuncture seems to be better than metformin in reducing BMI, although I think the caveat here is that most of the trials are at high or unclear risk of bias. There was high heterogeneity, and they generally very small trials. Also, just a caveat with our BMI meta-analysis, we haven't gone on to do the sensitivity analysis yet. And so this research is still unpublished, but we aim to submit it for publication early next year. We also found that acupuncture was a bit better than metformin in terms of lowering waist-hip ratio. And then interestingly, there were 6 trials that showed that there was no difference between acupuncture and metformin for reducing HOMA-IR and FINS's fasting insulin level. So I think that's interesting in itself because it seems to suggest that acupuncture and metformin may be similar in action. And this is my last slide. I'm not talking about yoga today because there are so many experts talking about yoga, and I'm sure it will be a very successful dialogue. I'd just like to end with just a slide on mindfulness-based interventions. Now, mindfulness is obviously a very big part of yoga therapy. Mindfulness-based interventions have been shown in large meta-analyses to be beneficial for managing weight in the general population. So they help people, I guess, accept the discomfort of calorie restriction and of starting physical activity. But there have only been 2 fairly small trials done in women with PCOS. But again, you know, thinking about the priority that we need to place on our psychological symptoms, I think these probably show promise and warrant further research. So both of these RCTs showed that mindfulness-based interventions improve stress levels and may also improve fasting glucose. So that's all from me today. I just wanted to say I think what you're doing is absolutely innovative. I think it's pioneering. I'm so inspired by the work that everyone is doing today. I'm very sorry I can't stay for too much longer, but I'm really happy to share my slides with everyone and really looking forward to an ongoing collaboration. Thank you so much to everyone who convened the Intersystem Dialogue.
Thank you. Thank you very much for a very nice presentation. And actually, it reminds me that how natural therapies and naturopathy, they go hand in hand. In naturopathy also, we use natural products. And when we look at some of your points, it also reminds me Ayurveda as well. And when we speak about acupuncture, it reminds that meridian theory of Chinese medicine and that of Nadi and Srotas of Yoga and Ayurveda. They go parallel. So I think there is a lot of work to be done in this particular direction. Thanks a lot for a very nice presentation and a lot of new stuff. Thank you very much.
Yes, excellent. Excellent.
Now we will go ahead with our next speaker, none other than Dr. Ishwar Basavaraddi, and I take opportunity to introduce him. Sir very graciously accepted our invitation and let me introduce him. He's MSc, he's a physicist, MSc in physics, and then he did MA in philosophy and PhD in yoga philosophy. He is a director of Morarji Desai National Institute of Yoga and Naturopathy under Ministry of Ayush, Government of India. He is advisor to Yoga and Naturopathy to the Ministry of Ayush. He is a Chief Executive Officer, CEO for Yoga Certification Board, YCB, under Ministry of Ayush. He has more than 30 years of professional experience in yoga education, therapy, and research. He has imparted yoga training and therapy to more than 1 lakh people, all sections of the society, and has participated in more than 400 national and international conferences, seminars, and presented research papers and delivered more than 1,200 lectures or lecture-cum demonstrations in India and abroad. He has established preventive healthcare units of yoga, 20 CGHS dispensaries at Delhi and NCR. He is a member of several national and international committees or bodies such as UGC, NCTE, NCERT, CBSC, SAI, AISC, ICCR, ICMR, Railway Board, and so many others. He is an honorary professor for India China College, Kunming, China, and many more to his list. He is a founder secretary general of Indian Yoga Association, a self-regulatory body of leading yoga institutions in India. He is a master of the ceremony, giving yoga instruction to many dignitaries, including our Honorable Prime Minister of India at Rajpath, New Delhi, Rama Vaidya Ambedkar Stadium, Lucknow, Forest Research Institute Ground, Dehradun, and Prabhat Tara, Ranchi, Jharkhand, on the occasion of International Yoga Day. So let me have opportunity to call upon Dr. Ishwar sir to have his presentation. Namaste, sir. Sir, you are unmute.
Om Shanti Shanti Shanti. Namaste, madam. Vaid madam, namaste. Namaste, Patak sir, and all the professors. I'll just share my presentation. I hope you all see the presentation.
Yeah. Yes.
Thank you, sir. Before I would like to start, thanks for very good words. I'm very humble. I'm just doing my, trying to do my sincere service for the well-being of the people from all parts of the world through our Indian culture and tradition, very rich tradition, yoga. Thanks for the opportunity. Very much, madam, for inviting me. And as you know, now the technology made us to rush simultaneously, being the head of many organizations. Simultaneously, I have to attend sometime, not all the time, simultaneous webinars. That's an important webinar on policy making webinar on WHO and physical activity was going on. I just completed. I will take, I do notice the presence of many of our yoga colleagues. Ulka ji is there, and many others are also present. My pronouns to you all. I am humble just to share some of the things. I don't want to mention about much for all medical professionals. Most importantly, yogic lifestyle, a form of holistic mind-body medicine, what is nowadays known globally, is known to reduce stress and sympathetic tone and helps in the management of PCOS. So I have mentioned only 3 points taking from our quote from our Honorable Prime Minister of India, addressing to the United Nations on 27th September 2014, where he mentioned yoga is an invaluable gift of ancient Indian tradition. It embodies a unity of mind and body, thought and action, restraint and fulfillment, harmony between man and nature, and a holistic approach to health and well-being. Very comprehensive meaning and utility of yoga has been given. And we all know that world has changed after that declaration of International Day of Yoga. On 21st of June every year we are celebrating. And this one, these things has been helped to growth of yoga exponentially during last 7 years. United Nations mentioned in its citation that yoga provides a holistic approach to health and well-being. Because I do know, being a member of WHO and UNESCO, etc., whenever they adopt any one definition or a quote or any this thing, we have to provide a lot of evidences for them. Otherwise, they will not accept it. So I'm very happy that these two have been accepted by the United Nations in its citation. You can see it is a holistic approach to health and well-being. It brings harmony in all walks of life, and thus is known for disease prevention, health prevention, promotion, and management of many lifestyle-related disorders, including the PCOS. Stress and obesity, influence of stress and obesity in the PCOS. There is a strong relation between obesity, stress, and PCOS. Approximately 50 to 60% of women with PCOS are obese or overweight. It is believed that both the genetic predisposition and lifestyle factors contribute to the etiology of PCOS. Altered lifestyle that includes high calorie diet and lack of exercise resulting in obesity or overweight, and insulin resistance, which has been well recognized as an exacerbating factor for PCOS. There are studies suggested that chronic stimulation of sympathetic activity, a result of stressful lifestyle, can induce dysregulation of hypothalamus pituitary ovarian axis (HPO) axis in women with PCOS. Due to stress, cortisol levels becomes very high, which are called stress hormones, and it is one of the major cause of fat storage and gaining in the weight. So most of the time I present this slide, and exactly yoga helps us. Whenever we practice very classical half an hour yoga, only 30 minutes of yoga, anybody, including the men suffering from the PCOS, it reduces stress. Once the stress is at the zero level or in the reduced state, and there is increased mindfulness, which helps to improve the calm and quiet mind, always helps for the improved metabolism. This is very, very important. That improves the quality of sleep and relaxation. When these two are taken place, then there is a feeling of well-being and positive health. And this slide has been prepared with on the basis of many evidences. Now, yoga is a complete prescription for the healthy body and mind, which can destroy the root cause of PCOS, and that is stress and obesity. Yoga leads to better quality of life in the PCOS. Daily yoga for 30 minutes. I prefer 40-45 minutes. So if people don't get it, nowadays we are coming up with many modules. Let us practice 30 minutes in the morning and 15-20 minutes in the evening. Pranayama and relaxation techniques. In the COVID-19 conditions, we recommended that to the medical professionals, and we come up with a very, very encouraging results. Therefore, 30 minutes of yogasana, dhyana helps in weight reduction and stress management, which ultimately stabilize the normal function of hypothalamus, pituitary ovarian axis, and in the management of PCOS. I don't use the word cure. Effect of yoga in the PCOS. Research study shows that regular yoga practice. So many times I mentioned that major yoga practices are 3. It is always a combination. Whenever we talk, there are many practices, but few asanas and a very important pranayama and dhyana. Dhyana is a compulsion. It is the package, it's a capsule. Whenever we practice regularly, and conventional physical exercise on glucose metabolism and lipid profile in PCOS subjects, after practicing it daily for 1 hour for consecutive 12 weeks, and found that yoga was more effective than conventional physical exercise in improving glucose, lipid, insulin sensitivity. And there are many hundreds of studies like this. I do hope that Dr. Ulka and Dr. Satish and others will emphasize on that. Yoga practices like asana designed for PCOS help in opening up pelvic area and promote relaxation. But I found that in my earlier days in the universities, especially Setu Bandhasana, Sarvangasana, Viprit Karani, Chakrasana, Bhadrasana, etc. are found to be very useful, though they are a little bit of advanced practices considering today's physical activity, not in the earlier, they are all simple practices, Sarvangasana, Chakrasana. Everyone used to practice it. Nowadays, life has become so sedative, and even stretching arms has become very difficult. But I recommend, I found in the university campus, in the age group from the earlier age to the 40, 45, 55, most of them are so happy that many of these conditions are not being managed by meditation, etc. But simple 2 to 3 months of practice help them to overcome many of these PCOS. In PCOD, yoga practice reduce stress and sympathetic tone, and in the one reported enhanced hormonal profile in women suffering from PCOS following a 12-week integrated yoga intervention. Yoga practices reduce the stress and anxiety and thereby balancing the HPO and HPA axis. And yoga intervention at significant lower free testosterone levels. Yoga can also have a positive impact on insulin and cholesterol levels in women with PCOS. And like this, many research studies you can have it. Alterations in brain waves, basically an increase in alpha waves and decrease in serum cortisol level was observed during the yoga intervention. Recent evidence shows significant health benefits of yoga for improving anxiety hormones, menstrual cycles, and metabolic parameters among women with PCOS. Yoga practice also reduces anxiety for women with PCOS to improve sex hormones and regulate menstrual cycles. And there are many practices. Surya Namaskar is the one, but I suggest with the age and particular conditions, the Surya Namaskara should be modified. That's why whenever we recommend yoga therapy, always it is under the supervision and guidance of an expert who knows these disease conditions. In the yoga field, we find many of them are the trainers who are not well versed with therapeutical conditions. Sometimes in the chronic conditions, it leads to a problem. So though we recommend some of the practices here, even I mentioned Setubandhasana, Sarvangasana, Chakrasana, Baddhakonasana. So we use them particularly depending upon the individual to individual basis. So largely Surya Namaskara has found very useful. Along with the breathing pattern, it balances the whole endocrine system by direct massaging glands and increasing blood flow to the organ, thus regularizes the menstrual cycle. The entire one Surya Namaskara has found very useful. But I recommend there are 5 stages of Surya Namaskara. I found in the university students and more than 400 students, I worked for 5 years. When it worked with breathing and also chanting of mantras. So we, if they don't chant, but at least humming of songs, etc. So we integrated very effectively, and that found very useful. Not only just a physical form of Surya Namaskara, but regulated with breathing and also the chanting of mantras, which creates the resonance effect in the brains. Sun salutation or Surya Namaskara significantly decreases blood sugar level, increases insulin sensitivity, improves lipid profile and results in weight reduction, improves BMI, low waist hip tissue, and there are hundreds of research papers on that. And everybody agreed, whatever it may be, Nadi Shodhan Pranayam. But many times nowadays, Nadi Shodhan Pranayam means just breathe in and breathe out, but it's a very scientific pranayama, and it should be performed with care, with proper ratios. So when you completely do it for 8 to 10 times, it creates an electromagnetic energy type of thing, which opens up the central nadis. So that pranayama is found to be very effective. And Brahmari also, there are various kinds of Brahmari. Sometimes we do that, this, etc. But reducing the sound while inhaling, exhaling, and managing the resonance with the throat contraction, etc. They are very useful. That's why it's a mind-body practice. With each individuals, we have to manage that. Because I'm a technocrat, I'm explaining a little bit, not only presenting the research, where I found the effect. Because I found these are the impact on managing these PCOS. The researchers simply they present, but we know how it works. So that's why I'm a little bit of giving my experiences also. Breathing techniques purify the subtle energy channels and enabling smooth flow of vital energy. So that's why Nadi Shodhan is very, very important, and they helps to calm down the body and relieve the stress. Controlled breathing techniques tones up nervous system, improves stability, eliminate anxiety. Already mindful meditation, etc. My earlier presenter from China, she has also endorsed our use and increases the insulin sensitivity. Now the men diagnosed with PCOS have profound insulin resistance, obesity, and increased level of androgens. Weight reduction is main preventive and therapeutic potential to combat with this catastrophe, which can be achieved by incorporating lifestyle modifications. Everybody agreed. Breathing techniques helps a lot in relieving the symptoms of PCOS related to deep-rooted mental stress and keep the individuals high to fight with this syndrome. All these lifestyle modifications increase the fertility rate and improve the quality of lifestyle in the patients of PCOS. I suggest three things. So one is the many people in yoga, we never emphasize on the diet. In the lifestyle diet, we are Indians and we follow, as earlier also mentioned, we follow the Ayurveda and we are all the one systems when it comes to the holistic health. We are not separate. But nowadays we developed independently, but it is a specialization. But when it comes to the holistic health, we have to complement each other. Where in Ayurveda, we take the dinacharya, rutucharya, what to eat, what not to eat. So I found that that is also a very important component, and I don't want to go into detail. So in the metabolism and proper diet plays an important role. Next comes the yoga practice helps to improve the metabolic activity and also quality of sleep. So this is the second one. Third one, most importantly, the management of lifestyle. So the first one is it is the food and yoga and lifestyle management. Third one needs frequent counseling and proper atmosphere are very much essential. Nowadays our women population are missing out because many of them will start working, and we know the working conditions are not 100% favorable for many of the women population. Therefore, appropriate working conditions at workplace and also has to be improved. These three are very much, you can make it in a regulation. These three are very, very important in the management of PCOS whenever we come to the policies. For this one, now for the information, in the WHO in collaboration, just now I presented 1 hour before, we have come up with a WHO Yoga app. So you all practice common yoga protocol of 45 minutes from last 7 years. So for your information, more than 300 million people are practicing it nowadays. So with the collaboration of WHO, we have come up with the app, 45 minutes, 20 minutes, and 10 minutes. And many of the experts sitting here are also part of this initiative in one or the other way. And there we have come up with several initiatives. One is it is the model, teaching models are also there, 31 practices, and they are in audio form and video form and various languages. Now it is in Hindi and English. Now we are coming up with multiple international and Indian languages in the years to come. Apart from this first initiative, we are also doing the pre-diabetic and mental health and other rehabilitation for cancer patients. The models are ready. We are coming up with the app. It's a very extensive procedure to convince the WHO of strategies, because they have a lot of formalities to accept any intervention. And 2 years we did a lot of things, and this has been launched by Honorable Prime Minister on 21st June 2021 on the day of International Day of Yoga. So therefore I request all the medical professionals, you can just go to Android or iPhone, anything, WHO Yoga app you can have, and it's a proud product of India. The whole world is using it. These are the details I already had given. And another initiative, and Professor Satish Patak sir and Lukazi and everybody knows that we have come up with a yoga break. We designed it 2 years back, and we have conducted trials, including Bombay, in 6 metros. 717 participants who practice it for just 15 days, twice a day. So it's a very simple practice which can be practiced at the workplace. Especially I designed it for the women community. I'm not told, but I found that very sincere women population. I appreciate my institution also. They are very sensitive and they are prone for stress and anxiety. And this 5 or 6 exactly takes 6 minutes. But I've been compelled to make it for 5 minutes, but it takes 6 minutes twice a day, in the first half, in the second half, and it will not increase the stress level at all. If you practice it every day and twice, and whatever the stress it is accumulated, it will help to disseminate it. It's a simple practice. I'm not exaggerating, and I'm very proud, and this works well. Please, if you don't have time for nowadays, earlier when I start my yoga,